Professor McLemore, I'd like to bring you into the conversation. You and Dr. Scott recently penned an editorial for the Los Angeles Times. You wrote, reimagining Black maternal health in the United States cannot be separated from the issue of health equity. We can't improve outcomes without listening to, honoring, and understanding the full lives and experiences of Black people. Why aren't Black women being heard or believed? And is this another consequence of America's long legacy of segregated healthcare?
So if we already know that the majority of maternal deaths happen in the postpartum period, where there's less, surveillance, there's less reporting of symptoms, where people are basically left without a social safety net in the postpartum period, then if you're already less likely to be believed, let alone heard. Being heard is one thing. Being believed is another thing, right? Serena Williams taught us that. So if you are in a position where you're a new parent, you're sleep deprived, you're trying to have a family transition with the person involved in your pregnancy and maybe parent other children, and you're trying to talk with your healthcare team about symptoms that may or may not fit a good algorithm, but are really giving people who are really listening some signs and symptoms that you might be deteriorating. If your team's in conflict, you're going to miss that. So Black women who are less likely to be believed, who are less likely to be heard, we have studies of residents and physicians, stating that we are less likely to experience pain. If that's already the milieu in which you are trying to explain what's going on within your own body, where you are an expert at home in community, then you're less likely. We're going to miss vital time points in that period where we potentially could have intervened. And that's what we mean when we say a lot of maternal morbidity and mortality and 60 to 70% of cases probably could have been prevented. It's because when we go back and look at maternal morbidity mortality review committees, where every death is reviewed to understand what the root cause was for that death, in retrospect, you can see many places where intervention should have happened. Multiple visits to the emergency department, multiple phone calls to their healthcare providers. But again, you're not seeing that connection of, wow, this is a potential maternal death that we could have prevented. When we think about structural issues, right, in places where, let's say, where rural hospitals have lost their obstetric units, where historically we've always sent pregnant people, send them up to labor and delivery. They will be able to take very good care of those patients. Well, when you lose an inpatient rural obstetric unit, that doesn't necessarily assume that the people in the emergency department can pick up that expertise, those fine, areas where my spidey senses are tingling, something's going on here, that would alert you earlier to a sign and symptom of deterioration. So it's bigger than that. It's not just at the individual level, it's at the systems level. If we're not all aligned to be able to protect birthing people, if we all don't have our senses attuned to the people who are most vulnerable, then we won't see good outcomes. I say this often, but if we center the people who experience the greatest burden, care actually really should improve for everybody, not just for Black women.